Social welfare legal problems concerning housing, welfare benefits, debt, employment and discrimination can directly and indirectly influence health. For example, through poorer diet, adverse living conditions, social exclusion and chronic stress. This relationship also works in the other direction, so transitions into poor health can increase the chance of experiencing social welfare difficulties. GPs and other healthcare professionals are well placed to identify people experiencing such issues, and also those whose health is affecting their social circumstances. However, they lack specialist expertise, up-to-date information and of course time to support patients. Evidence suggests GPs are increasingly being asked for support linked to patient social welfare problems, taking up an estimated 20% of consultation time. Many of these issues can be addressed through social welfare law, advice and assistance, and collaborations between health and care settings and welfare advice services are one way to improve access, to reach people most in need and to address underlying social determinants of health. However, there has been limited available evidence to support such collaborations, and services are at constant risk of closure. Our research focused on co-location of welfare advice services physically within general practices. We asked whether receiving co-located social welfare advice leads to improvements in patient mental health and well-being. To do this, we compared changes in these outcomes among people receiving co-located advice to a similar group of people who did not. And the way that we collected and analysed the data means that we could have confidence that any differences found between the changes observed in the two groups over time were linked to whether or not they received advice. We found that over time, compared to those not receiving advice, there was a significantly greater reduction in common mental disorder for females and also for Black or Black British participants, a 63% and 91% bigger reduction respectively. Those who had a positive outcome of advice, for example improved income or housing circumstances, experienced significantly improved mental well-being. And there was also a significantly greater, 58% bigger reduction in the experience of financial strain. For every £1 spent by commissioners paying for the service, advice recipients gained on average £15 per person. Importantly, had the service not been there, nearly half of recipients would not have sought advice or would have turned to their GP. Lastly, we found that while practices may experience several barriers to working collaboratively, there are lots of ways to encourage this. More details can be found in the online reports, alongside a UCL mapping study of health and legal service collaborations in England and Wales conducted by Sarah Bearden and Professor Dame Hazel Genn. Co-location alone is not enough for optimal collaborative practice, yet implementing such services is low cost, improves patient mental health and well-being, and reduces stress from financial strain.